Good afternoon, everyone. Thank you for taking time to join us today. My name is Dr. Adrienne Collier, and I'm a pediatrician with the Permanente Medical Group, and I work at the Largo Medical Center. I'm also a mother of 4 children, ranging between the ages of 6 and 14. Today, we're going to be talking about RSV, flu, and other viral illnesses that you're seeing among your family, your friends, and in your community during this season. I'm joined by some of my amazing colleagues who are going to contribute to this discussion, Dr. Amanda Bauer, Dr. Eric McDonald, and Dr. Heather Williams. At this time, I'll allow them to introduce themselves, and then we'll jump right into the discussion.
Hello, I'm Dr. Amanda Bauer. I'm a board-certified emergency physician with Kaiser Permanente, and I'm the Chief of Acute Care for the Baltimore service area. Really excited to join all of you today and talk about these viruses that are really at the top of all of our minds right now.
Thank you, Amanda. Yes, I'm Dr. Eric McDonald. I'm a board-certified emergency physician as well, and I'm father of 3 children. I'm a doctor that works at Largo and also at Camp Springs. I'm also an Army veteran, so happy Veterans Day to everyone out there. And I'm also excited to talk to you about all the viruses and all the visits that we've seen recently.
Hi, I'm Dr. Heather Williams. I work I'm a board certified family medicine physician, and I work virtually with Kaiser Permanente's Physician Care Plus team. I have 2 children twins who are 6 years old. So they definitely are exposed to and bring home these germs all the time. So this is very relevant, not just in my professional life, but also in our home.
So this discussion is extremely timely, given the surge that we're seeing in our communities, given the shortage of hospital beds, the volume of patients that we're seeing in our urgent care. So as we enter the winter months, we want to talk amongst ourselves and provide some information to the community so that people know the symptoms and signs of these viruses and what to do if they themselves are impacted or their family or friends are impacted. So with that, we'll get started right away with the questions. So Dr. Bauer, can you describe for us what is RSV? What does it mean? What are the symptoms that you're seeing in your patients?
Yeah, so RSV is respiratory syncytial virus, and it has been around for a long time. This is something we see every winter. And so it's got a lot of attention lately, but for most adults, it just feels like a regular cold. It's a lot of congestion, a lot of runny nose, some coughs. In our youngest patients, under the age of 2, it can have more respiratory components, and they might have more difficulty breathing and coughing. But the reality is we treat this like we treat any other cold unless there's a respiratory problem. If there's actually difficulty breathing, then we kind of escalate things.
Excellent. So Dr. McDonald, are you seeing a lot of these cases in the urgent care where you practice? And what do you think is contributing to the surge?
Well, the answer is yes. We are seeing a lot of these patients in the urgent care. Last year, during this time of year, we really didn't have very many patients with flu and RSV. We think primarily because of social distancing and people wearing masks and some of the other protective measures. But this year, because masks have kind of gone away, and social distancing is something that a lot of us aren't doing as much anymore, we're seeing way more of these patients. Also, we're seeing an early rise in the flu patients. Influenza is also spiking earlier this year as well. So we're really having all those together. We're having a kind of a meeting of these, the influenza, RSV, and COVID kind of coming together. So that's what's causing the increased surge that we're seeing right now.
So Dr. Williams, can you chime in and let the folks watching know why older adults and elderly people and infants and younger children are more severely impacted with RSV?
Absolutely. So anyone can get RSV. This is a virus that can affect you at any age, but for infants, for kids under age 2, their respiratory passages are more narrow. They're smaller, they're not as developed, especially babies who were born prematurely. And so they're more likely to have complications with breathing with viruses that affect those parts of their body. As we age, especially older patients, the immune system starts to weaken and it doesn't work as well. So it might take us longer to recover from illnesses, and we may have more severe complications, especially for older patients who have a lot of other medical problems.
Excellent. Thank you for that explanation. So Dr. Bauer or Dr. McDonald, what should families do if they're seeing RSV symptoms in their children? And can you describe some of those symptoms?
Sure, I can start off, Amanda. You can always add on, but I would say that, there are some symptoms, there are some mild symptoms, and there's more moderate to severe symptoms. Some of the mild symptoms would include runny nose, cough. Those are some of the milder symptoms. But then when the child starts having difficulty breathing, and if there's any sort of retractions or where the child is grunting, those are the more severe symptoms, as well as apnea, where the child would stop breathing. So those are the times that we want you to seek medical care. But for some of the milder symptoms, just runny nose and a little bit of cough, with no respiratory distress or problems, those symptoms don't always need a visit to the urgent care because they're milder symptoms. I don't know, Amanda, if you have anything else to add to that.
No, that's really the same picture. It's like with a virus, it depends on how sick you are, whatever the virus is.
Right.
Yeah, I think it's important to point out for everyone watching that many times the symptoms of COVID, flu, and RSV are the same.
Right.
But as Dr. Williams was saying, the immune system loses its ability to fight as strongly as you age. And for babies, it's very difficult for babies to blow their nose or to expel sputum to get the mucus out of the airways. So as a pediatrician, the way I explain it to my families is, imagine trying to breathe through a tea stirrer, a very narrow drinking straw, and the straw is lined with gunk. So there's a lot of mucus in those tiny, tiny airways, and the babies can't breathe, right? So if they sneeze, that's great because it gets the mucus out. But if not, those airways become clogged and they'll grunt or retract or start belly breathing to try and increase the pressure in the airways to expel the mucus out. And that's when we see babies who are in respiratory distress. They may be breathing rapidly, they may be grunting, their nose may be flaring, and those are the babies that we need to see in the office. Because honestly, the management for all of these viruses is exactly the same for COVID, for flu, and for RSV, particularly for infants. Older adults and seniors can take over-the-counter medications, but the mainstay of care for these viral illnesses is supportive. Mm-hmm. So with that, Dr. Williams, how do we tell the difference?
So there are tests, of course, where we've all become extremely familiar with COVID tests over the last couple years. Those exist both in labs and at our homes. I'm sure all of us have a stack of COVID tests. There are tests for flu and RSV that are available through labs. But remember, like Dr. Collier just said, just because we know what virus is causing the problem doesn't mean that anything changes. A lot of the management is exactly the same. So if you have mild to moderate symptoms and you're safe to stay at home, it doesn't always make much sense to get a test. Certainly, because COVID tests are so easy to do at home, do them. But for flu and RSV, you don't have to necessarily be tested. We're going to manage your symptoms, and we're going to make sure that you don't need to come in, and you don't need to have any more invasive or intensive medical intervention. So we don't always test. I actually had my son home a couple weeks ago, and even though it would have been nice to know why does he have a fever and respiratory symptoms, we chose not to seek care because he really was handling it well, and it was just a matter of keeping him home to keep other people from getting sick and to just make sure that he felt better. And in a few days, that was the case, but we didn't get him tested.
Heather, I was going to add, I also have twins as well. I have 9-year-old twins, and the same thing happened with my kids a couple of weeks ago, because when a virus comes, it just kind of goes through the whole house. Mm-hmm. So we did the same sort of thing and kept the kids home. So that method does work, especially for mild cases.
Sorry. Thank you, Dr. McDonald and Dr. Williams. So Dr. Bauer, when you're talking with families, when you're talking with adults, the question always comes up, well, how long do I stay at home? Is it 5 days? Is it 7 days? Is it 10 days? Is it 2 weeks? So what do you recommend to your patients with regards to quarantine? And how contagious are these viruses?
Yeah, I mean, these viruses are very contagious. As we hear the examples, they're going through a household because if one child's going to get sick, the next child's going to get sick. So they are very contagious. And so in an ideal world, we would stay home for 7 days with any virus, that we would actually stay home and prevent spreading it to other people. At the very, very least, it should be 48 hours after the last fever. You definitely, like, if you're still coughing, if you're still doing things, like, you really don't want to be out in public.
Right.
You probably are contagious. You probably are spreading something. We know with COVID, sometimes people can spread the virus even after 10 days if they're still coughing and still sick. So it's like, some of it is your symptoms.
Absolutely. So what I
So.
usually tell families is a minimum probably of 5 days, especially given that children under 3 aren't wearing masks in daycare and children over 3 aren't wearing masks in schools. There's no more social distancing. So I think minimum 5 business days if we're talking about daycare or school. So I'm going to pause right now and go to our chat. We have a question from Facebook. RSV doesn't normally require antibiotics, but at what point would antibiotics be needed? So I'll take it and then I'll toss the mic over to Dr. McDonald. So RSV is a virus, right? So we know that viral infections are treated with supportive care. There is no antibiotic that's going to treat RSV. And also there's no antiviral that we have for RSV. Of note, RSV can cause a secondary pneumonia. Right. So if a patient was infected with RSV, wasn't getting better, was having persistent fevers, trouble breathing, it's quite possible that we would order a chest x-ray. And if that revealed pneumonia, then we would probably treat with an antibiotic. What are your thoughts, Dr. McDonald?
Yes, Dr. Collier, I agree with you. For most cases, no antibiotics are needed, but in cases where the child isn't improving and a chest x-ray is obtained and that shows that there's a focal infiltrate with fever, then we would most likely use antibiotics just because of superinfection or secondary infection. So I agree 100%.
Dr. Bauer, do you also see possible secondary bacterial infection of the lungs with flu and COVID?
Yes, with any virus, we can see secondary bacterial infections, whether it be sinusitis or pneumonia. One of the key things is that these secondary infections generally happen more than 5 days after you started getting sick, right? So like we're talking about the staying 5 days out of school or daycare or things, it's often a longer part of the process when you're like, okay, it's 7 or 8 or 9 or 10 days. Like this is when we're starting to think about things like sinusitis and pneumonias.
Right. We have another question from Facebook. How can children, or adults for that matter, with special needs and compromised immune systems wear a mask at school? How can we protect our vulnerable patients and population against RSV? Dr. Williams?
Well, continuing, if you do have a family member with significant health issues that would put them at risk for complications of any of these viruses, it's not a bad idea to continue some of that social distancing through the flu and RSV and season. I almost said COVID season. Unfortunately, it's not been just a season. So some of the social distancing is still probably helpful for your family. Choosing to continue to wear a mask is helpful. I know that especially in children, they don't want to wear masks. Most of us as adults don't want to wear masks either. But if you are having any any symptoms of any of these viruses, even if you're beyond those worst few days of being ill and you're able to return to work or school, considering wearing a mask can help protect others. You may get some benefit wearing a mask to protect yourself, but the mask really prevents the person who's sick from spreading those germs more than it protects the person who's not from getting sick.
Right. So I'd like to make a plug for hand hygiene, right? So we still want to wash our hands frequently. We should still be using hand sanitizer when we don't have access to soap and water. So with that question, I'd like to segue into some questions about immunizations and vaccines. Dr. Bauer, is there a vaccine for RSV or flu or COVID that could help protect our family members and community?
We are, as everyone probably knows very well, we have a lot of COVID vaccines. Seems like we've had, like, my card is filled and then now to the second page. And the current new, like, updated COVID vaccine covers more strains than the earlier one. So I really encourage you, if you can, to come in and get this updated booster, as well as our flu shots. The flu has started much earlier than usual this season. So it's like, get your flu shot as soon as you can. And if you are a healthy, person and generally don't have a lot of medical problems, you have a strong immune system, you can get both right at the same time.
Right.
It's very easy. We have flu clinics at most of our Kaiser centers. You can walk right on in. They'll get you both right away.
Dr. McDonald, if someone is sick, right, and they present to your urgent care, they had a fever 2 days ago. Now they just have some cough and runny nose, some body aches. Is it safe for them to get their flu vaccine or COVID vaccination when they're ill?
So the person was sick a few days ago, but now is actually okay, you said?
They're getting better. They don't
Getting
have
better.
a fever anymore, but they still got some cough, some runny nose and congestion. Is it safe for them to get their vaccination?
I believe so. Yes, I believe that's perfectly warranted. And just so you know, the COVID-19 booster, is available for ages 5 and up. It's a bivalent vaccine. It protects against the original strands of COVID-19, plus the BA4 and the BA5 strands of the Omicron variant. So it is a more robust vaccine that's available. But no, but I definitely believe that you could get those vaccines even if you had some mild symptoms.
So Dr. Williams, let's say, I'm planning to get my vaccination and then the flu hits me, or, RSV hits my 6-year-old and he's at home, he's not eating as much, he has a fever, coughing a lot. What are some ways that we can help control our symptoms if we as adults are impacted by these viral illnesses or if our children are impacted?
So as you mentioned earlier, Dr. Collier, the main treatment for the majority of these viruses is supportive care. And that means that we treat your symptoms and your body fights off the virus on its own. For adults 50 and older, and for adults with, or people 12 and up with some medical problems, there are some oral medications for COVID specifically. They have to be started within a certain length of time. There are also, some medications for flu. We tend to use those even less often than with COVID, much less often. So most of the treatment really is just supportive care. There are over-the-counter medications, of course, for cold and flu symptoms. Make sure that you're familiar with the ages that you can use those. Talk to your pharmacist, call our nurse advice line, ask what you can and cannot use. But the most important thing is time. Your body will fight this off and you will start to get better, but it does take time. And in those few days that you're waiting, it feels like an eternity, but it will eventually get better.
So I'll just point out, for children 12 months and up, they can take honey for the cough. Honey has anti-inflammatory and antioxidant properties. It can coat the throat, which can ease some of that irritation that happens from cough. Of course, we always recommend lots of fluids, lots of rest, symptomatic management of fever with Tylenol for children 2 months to 6 months, and then ibuprofen for children 6 months and over. Frequent nasal suctioning is extremely important in RSV because those airways are clogged with mucus and little ones cannot get the mucus out. So we recommend, bulb suction, the nose breather. There's a lot of products on the market that families can use. Humidifiers are important as well, but if families don't have a humidifier for their little ones, they can sit in the bathroom, let the hot water run, fill it up with steam, and that can help open the airways as well. So I think what's most challenging for families is that we don't have an answer, right? I can't tell you how long the symptoms are going to last. I can't tell you, what medication to take, but I can tell you, okay, yes, give a multivitamin, give some elderberry, give lots of honey, give tea with lemon, and these things can all help with the symptom management. All right.
Oh,
So,
I had one thing to add.
yeah,
Dr. Collier. One of the things I was going to also mention was I think that what a lot of people have probably been hearing is when they look at the news and hear the media, they're hearing like the hype around RSV and about how there aren't hospital beds and there aren't beds at children's hospitals and other places. But I just wanted to mention that these are for the more severe cases. This doesn't include the average case or just a child that has a little bit of cough and a little bit of fever. These are for the cases of more severe where we need to hospitalize children. So I think that's part of the reason that we're seeing more people coming in, because they're hearing about that, not understanding that, hey, there's mild cases and there's also more severe cases.
absolutely. Thank you for pointing that out. So, Dr. Williams, what are some ways that families and community members can seek care? They may have questions. They may not be sure which viral illness they're dealing with. How can they seek care to prevent unnecessary non-emergent visits to the emergency room, non-emergent visits to the urgent care? How can they seek care if they or a loved one have these symptoms?
So within Kaiser Permanente, we have a number of ways that you can talk to nurses and physicians to talk about your symptoms and find out if you do need to be seen. Our nurse advice line is 24/7. You can call at any point and just say, this is what I'm feeling, I'm not sure, or this is what I see my child is exhibiting, I'm not sure. Another great resource we have on kp.org is the e-visit. This is a series of written questions that you can respond to for, not for all complaints, but for many complaints. And you'll receive a written response from one of our physicians within often just a few hours. And then there's also the Get Care Now feature, where you can have a video visit with one of our physicians with not much wait time. You don't always need to have a visit in person. In fact, most people don't need to be seen. And that's one of the times that, using one of these methods can help decide if you do need to be seen, because that's not always true. As we've said, some people do need to be seen, but just kind of running that by some of our physicians and nurses can help you decide that. And the one thing to keep in mind is the secure messaging system is great, but it can take up to 48 hours for someone to respond. So if you're really concerned about, do I need to go to the emergency room, or do I need to go to urgent care, or even just speak with a physician, secure messaging isn't the best way to do that, because it might be 2 days before you get a response.
So, Dr. Bauer, can you and Dr. McDonald chime in to let us know, and the people who are watching know, what symptoms would be a red flag, right? So when should someone seek care in person when they're experiencing symptoms of either RSV, influenza, or COVID? When should someone come in? Dr. Bauer, I'll let you take it first, and then we'll turn it over to Dr. McDonald.
Yeah, we've all had colds, and we've had colds through our, lives, right? So you kind of know, like the runny nose, the cough, those things are part of a virus. We don't need to know which one it is. It's supportive treatment, rest, take it easy. When you start to find like, if I'm walking to the bathroom, I'm having to catch my breath. Like I can't quite breathe well, or I'm talking to someone and I can't complete my sentence. Like I'm feeling short of breath. Those would be definitely signs that you need to reach out to us, that, maybe you need to get on that Get Care Now, or if it's more severe, get on with the advice nurse to get them more quick insight as to what's going on. With kids, you often see it in how they're breathing. So if you see, as parents, your children, and they're like not as playful as usual, like maybe they don't want to eat, like you watch their belly pulling in and out, you're like, this is not right. Like you will know your child is not right. Like this is a different thing. This is not like just a cold. This is like, now they're breathing funny, their nose is flaring, they're not wanting to drink. Dr. McDonald, do you want to chime in?
No, I think you did a great job, Amanda. I mean, I would just, the only thing I would add was that, if when it comes to adults, if you're having severe chest pain, altered mental status, if your person's confused, these are signs of an infection that's kind of progressed. So those are some of the red flags. And for children, like you mentioned, nasal flaring, grunting, retractions is when the child's using their belly to breathe. If the child has periods where they stop breathing, that's also very concerning, as well as if the child is vomiting, can't keep any fluids down, we worry about dehydration. These are all warning signs. Lethargy, if a child that's normally playful and active is now lethargic, that's also a sign. So these are all the things that we look for that would mean that you need to take it to the next level.
I think we can also point out too that the comorbid conditions that increase risk for severe COVID can also increase the risk for complications from flu and RSV. So for example, our adults who are diabetic, our adults with congestive heart failure, our children with asthma, our patients with sickle cell anemia, our patients with pulmonary conditions like emphysema, COPD, sarcoidosis, any patient who is immunocompromised. If you're experiencing symptoms of these viral illnesses, we would encourage you to reach out to your healthcare team or your physician for guidance so that you know when to seek care in person.
Right.
At this time, we have another question from Facebook. Is there a vaccine for RSV? So as a pediatrician in the group, I'll take that one. There is a vaccine for RSV. However, there are some caveats, right? So the only vaccine that we have right now for RSV is called, the brand name is Synagis, okay? It's for premature babies. And not just any premature baby, but premature babies that meet certain criteria. So it has to be an infant born 36 weeks or prior, but also an infant that had a complicated stay in the NICU. So if, for example, a baby that had an oxygen requirement, the lungs weren't fully developed and they couldn't breathe on their own for 2 weeks or more. Babies with congenital heart disease. So diseases of the heart that affect the vessels may be in the wrong place. Babies with chronic pulmonary disease. They're born very prematurely. The mom may have had to get certain medications to try and get the lungs to develop before they delivered the baby. Those are the people that qualify for the vaccine for RSV. So really, it's just infants, honestly. And we see those infants after they come out of the NICU, and then they're given the RSV vaccine for 12 months, one vaccine per month for a period of 12 months after they're discharged. And that's something that they come into the pediatric office to get as we're doing their routine well visits. I do know that there are vaccines in development for RSV, but right now that's all we have. Okay. So how does a family member or someone who's watching schedule a flu shot? How can they schedule their COVID vaccine, Dr. Williams?
So through kp.org, that's the easiest way to schedule vaccines. It's quick. You don't have to wait on hold. You can schedule your appointment. Many of our centers are able to do both the flu and COVID vaccine at the same time. As Dr. Bauer, I think, mentioned, if you're healthy enough and if you qualify for that. So scheduling the appointment online. We do still have some centers with walk-in flu clinic availability. So check kp.org. That's the easiest way to find which centers, if your home center has it, or if you need to go to one of the larger centers.
So Dr. Bauer, what do you say to families who say, well, every time I get the flu shot, I get the flu. When I got the COVID vaccine, I was achy, I had a low grade fever. I didn't really feel good for 3 days. Is it safe to get the COVID vaccine? Is it safe to get the flu vaccine?
It absolutely is. And I try and set the stage and help people understand better. When you're first getting sick, like say you're getting a cold or getting the flu, when you're first getting sick, a lot of your symptoms are your immune system revving up to fight this challenge. And when we give a vaccine, we are giving the body a challenge. We are giving our immune system a challenge to step up to and to make a response to that helps protect us in the future. So we can expect to feel achy and feel tired and maybe almost feel like we're starting to get sick. That is our immune system doing its job and doing its job really well. I actually feel good when I'm like, oh, I'm really tired after my COVID vaccine. It's working. My body's getting in here, because you want that. I do say, try and plan your schedule a little bit. Let your body do its job. So don't plan on like running a marathon the day after you get your flu vaccine. Plan on taking it a little easy, being like, okay, good job, body. You're doing it. Let's rest.
Excellent. Dr. McDonald, Dr. Williams, and Dr. Bauer, we've talked a lot today about how patients can seek care. We've talked a lot today about what are the symptoms of these viral illnesses and how we can take care of ourselves and our loved ones and our community members, and also how we can prevent these illnesses from spreading. With that, we're going to close, but I just wanted to know if any of you had any closing comments or things that you wanted to say before we go off this Facebook Live. Dr. McDonald.
Actually, I did have one last closing comment. We spoke a lot today about some of the symptoms of RSV, flu, and COVID. We talked about the mild and moderate and even some severe symptoms. If a person is experiencing severe symptoms where a child is having accessory muscle use, is becoming altered, or confused, or very weak and lethargic, there are some cases where the patient, the family should call 911, as opposed to going, to the urgent care. Because we are able to care for a lot of patients, but if the patient is much sicker and more ill, we would prefer that they get the emergent care that they need as soon as possible. So that's just one caveat, just to make sure that everyone understands, for adults as well. There are some cases where the patient should call 911 and care can be rendered while they're going to the hospital, in lieu of that. That's just want to make sure people understood that. Thanks,
Dr. McDonald. Dr. Bauer?
Yeah, I just wanted to share that, we've come out of this time where we're very separate and we've been apart, and there's been benefits of that as far as less viruses, but it's been really hard on us all kind of emotionally, and we want to be together, and we really want to be together for our holidays. So, taking a few extra steps in your life now to make sure that you and your family can stay healthy and prevent spreading things, take a little bit off your agenda, like do a little bit less. If you're sleeping better, you're eating good food, your immune system's working better, you're less likely to get sick. And I saw the question came up in the chat, like, how do you keep from spreading the viruses around home? And it kind of comes the same way that we avoid spreading it everywhere else. Like, do the simple, basic things, sleep enough, eat well. If someone in the house has a virus, try and wear a mask if they can, wash your hands, don't touch your face with dirty hands. Like, it's the same things, that we've been doing, but just give yourself I really strongly encourage, give yourself a little bit of space. Don't try and schedule everything every minute, because the more reserve we have, the more likely we're able to all stay healthy and be able to be together through our holidays.
Mm-hmm. Oh, just one more additional thing to add. Also, things like elderberry, zinc, and vitamin C. Those things are very helpful, for adults to stay healthy through the cold and flu season as well.
Absolutely. Dr. Williams.
I think everyone has covered it well. I just echo everything that everyone said, and just remind everyone, we're still in this together. We felt that a lot early on in COVID, and like Dr. Bauer said, I think now we're tired, we want to socialize, we want to be around people, but we also need to remember that, keeping each other safe and healthy is a really important part of being a good community member. So remember, taking care of yourself and washing your hands and social distancing nobody wants to use it that term anymore, but taking time away from other people when you're sick, these are really important ways to keep us healthy as a whole community.
Right. Absolutely. So with regards to that last question that came in, get vaccinated. Anyone who is eligible for a COVID or a flu shot, if you're 6 months and older, get vaccinated, right? If you're sick, stay home. If you are able to, when you go into public places, maybe consider wearing a mask. Right. If you have immunocompromised family members or people who are on certain medications and you're not sure whether they should be vaccinated, reach out to your physician. We are here to help. We are walking through this season with you, your family physician, your pediatrician, your internist, your urgent care physician. We are all here to help. We're in this with you. We will get through this. As a pediatrician, this is not a surprise to me. This happens every year. What's happening now, though, is that we're seeing these viral surges earlier. So if you're able to, get vaccinated. If you have questions about vaccines, if you have symptoms and are unsure about how to manage them, reach out to your physician. That's what we are here for. We are happy to help. We want to keep you well, and we want to keep you out of urgent care in the emergency room when possible. If you're having severe symptoms, reach out to someone, get help, reach out to your physician. If you're severely ill, call 911. Don't wait to seek care. Because we want you to get care at the right place, at the right time, in the right setting, so that you can be well and be with your loved ones over the holidays. So I thank you, Dr. Bauer, Dr. Williams, Dr. McDonald, for your time today. Thank you to our organization for this platform so that we can share our knowledge with the community and provide all of the information that's needed so that we'll get through this triple pandemic, tridemic, whatever they're calling it now, together. Have a great afternoon, everyone. Thank you.